Tricia Helmers, and then myself, Nakia Lucina, and then also with us we have Nicole Thurman, who is helping out with the technology portion of it. So I apologize for the delay a little bit. We were waiting for some additional people to join us. What we want to start out with today, and as I go through the first slide, if you do have specific groups that these delays will apply to, and if you have any questions on those, after the presentation, if you want to send me an email or anybody in the agent team an email with your specific questions on the employer groups in the 51+ market, we'd appreciate that, and then we can walk through the case-by-case situation with you. But as you've seen, there's been a lot of correspondence going out within this last week of the additional delays again, and we may see more in the future as well, I guess. But for small businesses, we'll start out with small businesses. Under the Affordable Care Act, companies that have fewer than 50 employees are not required to provide coverage or fill out any forms in any year. Employers with 50 to 99 employees that do not yet provide quality affordable health insurance to the full-time workers will report on their workers and coverage in 2015, but they don't have the penalty for not offering affordable health coverage has been delayed until 2016. And again, I think you've seen some correspondence go out about that. For the larger employers with 100 or more employees, today's rules phase in the percentage of full-time workers that employers need to offer coverage to from 70% in 2015 to 95% in 2016 and beyond. So basically what that says is for those large employers, they need to offer coverage to at least 70% of their employee base in 2015 and 95% in 2016. We also wanted to touch on, because this comes up quite a bit, the employee categories for volunteers according to the U.S. Treasury Department fact sheet, and we have that available. We can send to you. It does state that for volunteer fire department or firefighters and emergency responders, they are not considered to be full-time employees, so they would not be included in those categories. For educational employees, for those who have school groups, it does say teachers and other educational employees will not be treated as part-time for the year, simply because their school is closed or operating on a limited schedule during the summer. So you would have to include them in your calculations. For seasonal employees, this question comes up quite a bit. The definition is those in positions for which the customary annual employment is 6 months or less generally will not be considered full-time employees. And again, if you have specific groups that this would pertain to, give us a call and we can walk through those with you.
I would say the biggest thing is just make sure the biggest announcement recently is the groups that have between 50 and 99 full-time employees, accounting the full-time equivalent, the penalty has been delayed till 2016. That's the biggest takeaway from all of this, is they pushed that back for those size of groups. The 100 plus is still 2015, like Nakia said. So like she said, if there's any specific questions, if you have groups on the bubble or you have groups in between that size, give us a call and we'll walk you through it. Next.
The employer reporting requirements, it sounds like that is still being determined. The IRS reporting rules for the groups that are 100 plus, it talks about that they're going to begin collecting data January 1, 2015 to report to the IRS by February 28, 2016. I know that Walmart has had some really good webinars, and we have access to those PowerPoints that give a little more specific information. We can send that to you, but it sounds like there's going to be some final guidance on the reporting requirements, and that will be issued pretty soon.
According to CMS, there will be a scheduled outage from Saturday, February 15th at 2 p.m. until Tuesday, February 18th at 4 p.m. The Social Security Administration, it will be conducting system maintenance. Now, February 15th is the cutoff to submit applications for March 1st effective dates. So You must make sure to complete your eligibility process and application prior to February 15th. If it's not complete, you can finish it online after February 18th, but you will have a 4/1 effective date. So if you need a 3/1, you need to make sure the application through healthcare.gov and your eligibility and the application have been submitted prior to February 15th. It sounds like it's going down at 2 o'clock. I would probably schedule it to be done prior to then, just to make sure you don't run into any problems. But again, take note of that. Make sure if you need a 3/1 to have that all submitted before February 15th. We've had some questions about agents being able to track their applications on the marketplace. There is not a way to do that currently, but it sounds like it is coming. We're not sure. We have we haven't received any information as to when that will be. Billing issues with the carriers through the marketplace. When an application is submitted online through the marketplace, you will receive a congratulations, you've enrolled. It'll show a picture of your monthly premium, the carrier you've applied with, and then a customer service number in the box below how to activate your coverage. You must wait 48 to 72 hours. Then you can call this customer service number. It goes to the provider, and that's how you can make an initial payment. Once that initial payment has been made, the policy is issued, and the carrier then will send you a welcome kit as to how to set up reoccurring payments. And as far as the direct link for the carrier websites, Coventry has one started. You can go to CoventryOneAgents.com and enroll through the marketplace direct through Coventry. There's a direct pathway, it's called. Co-Opportunity does not have one set up currently. If you need help going through Coventry, give us a call. It's an easier way. It's a lot easier than healthcare.gov, but if you only want to look at Coventry's products at this time, you can go direct through Coventry's website and enroll through it links you through healthcare.gov. It sounds like it's a very simple process. So if you have any questions, give us a call on that.
Broker blasts have been going out, or news alerts have been going out from Blue Cross Blue Shield. They've been having a webinar series, and it's my understanding that these webinars have been available to the large employers or employer market in the 51+ market, and then the agents as well. We have access to 2 of the presentations, and as Walmart is sending those presentations to us, we will post them out on the khiagents.com. The 3 presentations so far that we're aware of that Walmart has been delivering is the large employers and look back. We have that PowerPoint. Minimum value and affordability, we have that PowerPoint as well we can send. And then the next 2 that are upcoming, the 2 dates, is administrative and reporting requirements. They do a really good job of explaining on a step-by-step level. I do have one slide from one of the presentations that they gave to us, and it's called Affordability Stipulations for Dependents, because I know on large employers, we've been getting a lot of questions as far as the marketplace. And a couple bullet points that we have that I wanted to share is on one of their slides it says, affordability stipulations for dependents, no need to offer coverage to spouses, because I know we have some employers that do not want to offer coverage to the spouses. You must offer coverage to dependents up to age 26 of the full-time employees. Coverage does not need to be affordable for dependents. And then the last bullet point is important because we get this question a lot. If affordable minimum value coverage is made available to the employee, family members generally are unable to qualify for marketplace subsidies. And I think a few of you guys have run into that, and we have reconfirmed that that is the case. Again, if you have specific questions on that, you're welcome to send us an email. Okay, Avisus. This is Brenda. I'm going to take this. We had Steve Ellingbo from Avisus here the other day.
going over a lot of the vision, both the group standalone as well as the vision insurance with Avisos that you can sell through Wellmark. And there were some things that came up that I don't even think Wellmark was aware of. So we want to go through all of that step by step. The first thing I'm going to talk about, and Nicole, maybe you can help me out here, is I want to put up a slide or a sheet that you guys can see. If I can find it here, give me just a second. Where is it? The PDF? Okay, here we go. Bear with me. Okay. Hopefully everybody can see that. The first thing I'm going to talk about is the standalone Avisos group coverage. Now this is the exact same thing that we used to be able to offer on a standalone basis with a group. Basically, if you go this route with your groups, Avisos is going to send them a separate billing, just like they have in the past. We do have the 2014 brochure along with the rates, and I'm going to hopefully scroll down so you guys can see this. They have 3 plans available, just like they did before. Just to confirm, the way that the standalone group works, really you only have 2 options. Either it's 100% employer paid and everybody participates, that's the 100% participation rate, or it's strictly a voluntary where the employee pays. Those are really the only 2 choices. It's either all paid or none paid and voluntary. And if you do the voluntary, you have to have, I believe it is 10 employees for that, to sign up for that. If you do the employer paid, where it's 100% paid, it only requires 2 employees. And that's right on there under the little yellow section that says rates. All of that is right on there. And so if you guys do have a group that is interested in the Avisos Vision standalone, give us a call, because what we'll do is we'll contact Avisos, and they're really good about us creating a customizable or a customized enrollment form that you can hand out to all the employees, so it makes it really, really easy. So that's the regular standalone group. Like I said, it's either 100% or 100% employer paid, or it's all voluntary. What? Oh, the other thing that Avisos just added, and it's on the back side of this brochure, is there actually is an Avisos Vision and Hearing benefit. And that is all on here. There's some hearing coverage on there. The rates are on this brochure. I believe now it is, you have to have 10 eligible employees in order to add that benefit. So if you have any questions on that, give us a call. So that's the standalone group. Now the next thing I want to talk about, let's kind of switch gears here and talk about the pediatric, let's see, here it is. The pediatric vision benefit. I think, as most of you know, that if you sell the health insurance policy and you have a dependent that is 19 or younger on the plan, the vision coverage has to be included with it. And so here is, and you guys may or may not have already seen this, this is the actual pediatric vision benefit. So if you enroll somebody on an individual, let's say individual Wellmark plan, and they have children 19 and younger, this is the benefit that they are going to receive, as well as if you enroll anyone, let's say in a Wellmark small group, this is the benefit that they're going to receive. Now just remember, one of the things that I guess we didn't realize is that Avisos is going to actually send out an ID card for those dependents. And so I'll give you an example. I'm on the KHI small group plan. I have a son that's 18. I, in the mail, received an Avisos card with my son's name on it, and it kind of caught me off guard. I'm like, okay, what is this for? And then it finally dawned on me, well, it's because he has a vision benefit through my health plan. So if you get phone calls from people asking why they're getting vision cards, it's because they have dependents that are on their health insurance that are getting this pediatric benefit. Now, if you look at this one-page benefit summary, please notice that there is no out-of-network coverage. So they have to use network, Avisos network, in order to get this, these benefits. The one thing that we weren't aware of that we found out when Steve was here is that this network for Avisos through Wellmark is not the same exact network as if you did the standalone Avisos group that I talked about first. The biggest difference, he said, is that it does not have the chains like Walmart, Target, Sears, JCPenney's, I believe he said. We're trying to get our hands on the actual way to be able to go in there and pull up what the network is, and we have yet to get that from Steve, but just be aware that if you go on avisos.com and pull a provider report, it's what you're pulling is only for the standalone group. It's not going to be the same as if they have the pediatric vision, or we'll talk about the buy-up option in a minute, vision through Wellmark. So just know it's not exactly the same network, because I know a lot of people will go to Walmart and Target and Sears and those types of places. So if you have any questions on the pediatric or the standalone group, give us a call. The next Avisos piece that I want to talk about is what they're calling the adult buy-up option. Now this is the brochure that we just recently got our hands on, and this is for individuals with Wellmark can buy it, and this is true vision coverage. This is not like before where it's just a discount card. This is actual good vision insurance on a buy-up basis for individuals, as well as you can sell this with small group Wellmark. There is out-of-network benefits, and the one big point I want to say is that if you're online, let's say you're selling an individual Wellmark policy, and you sell the vision with it, what they call the buy-up option, which is what this is. When you print out the benefit summary, this is not what you're seeing. We found out that what's on the Wellmark website and what's printing out is incorrect. What's printing out, if any of you have sold it, and you can go back and look through your records, what is being printed or what is being shown is very similar to the pediatric benefit, where it shows there's no out-of-network benefits, and that's not correct. And so Wellmark is aware that they have the wrong benefit summary out there. They're supposedly fixing it, hopefully soon. So this is truly what the benefits would be if you sell the individual buy-up option, as well as if you sold this with the Wellmark group business. So just for an example, I know I had a Blue Cross group that was not non-grandfathered. I switched them to an ACA group plan with Wellmark. I added the vision because it's simple. You just click, 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 and they have the coverage. It comes the billing. They only have one billing. They have the Wellmark health insurance as well as the Avisos on one billing, which is really nice. I was not aware that the network is different, so you have to be careful with that. If you want the network with the Walmarts and the Targets, then you're going to have to do it as a standalone. So just know that the benefits are a little different, the network is different, and the pricing is different if you sell it, the vision, with Wellmark versus if you do it on a standalone basis. Now, the nice thing about selling the group, selling the vision with the Wellmark group is the fact that there's no participation requirement. So if you're selling a Wellmark small group, I would encourage you to add the vision benefit on there, and as long as you have one person sign up for it, then that benefit is turned on, and then anybody that wants to, any new hires that come on will be able to take that benefit. So there's definitely an advantage to being able to do it through Wellmark, because you don't have to worry about 100% employer paid. You don't have to worry about having 10 employees sign up for the vision. So we would suggest go ahead and offer that benefit, and if you can get one person to sign up for it, that would be great. So again, there's a lot of confusion around this because of the fact that the benefit summaries are not correct when you print out the vision insurance, the buy-up option for both individual and small group with Wellmark. So please give us a call if there's any questions on that. Okay, next.
Next, what we have, and I think you've seen some communication and some invites have been sent out via email to you guys, but KHI has partnered up with a company called Complete Wellness Solutions. It's a good opportunity and a good partnership that we're excited about, and it would be a good value add to your employer groups. I know we have some groups that ask, how do we start a wellness program? What incentives can we put in place? And we haven't had the resource to be able to help you consult with these employer groups. And so we're excited for this new opportunity, and we invite you to come to a couple of trainings that we have. One is scheduled for Tuesday, February 18th in Fort Dodge, and then Wednesday, February 19th in West Des Moines. And we have those locations available in specific, if you would RSVP to Sherry. The time is from 1 to 4. There are 3 CECs provided, and we encourage you to learn about best practices in implementing a wellness program, the latest statistics on why wellness is important. I think we hear a lot about that, and we're going to continue to hear more about wellness. It's not going to go away. And then also talk about the employer return on the investment and how wellness programs can ultimately affect the health insurance rates and the overall productivity of employees. And then also in compliance with health care reform, because as we know, that is in part of the Affordable Care Act is a component for wellness. We encourage you to invite or to attend one of the training seminars if you can, or if you need additional information on just the company in general, please email Sherry at sherry@khisolutions.com. We have a little bit of difficulty here. And then as usual, or as we always talk about, the KHIagents.com, we've been doing a little bit of some changing with the website, trying to keep everything updated as much as possible. As a reminder, there's a link out there for carrier forms, separated by market segment and by carrier. Any news blasts that we are sending out to you, those also are archived and saved out there. And then also, again, the videos and the slide presentations, the PowerPoints, the Walmart webinars, our webinars for today, and all of the healthcare reform updates that are out there. We encourage you to use those out when you're out in the industry and talking to employer groups or even in the individual market as well. Yeah, and I think we have some questions that we need to address, and we're going to try and answer those specifically right now if we can. The first one states March 1st effective date deadline is February 23rd. Is that correct? It is only marketplace applications that need to be submitted by February 15th?
That's correct. Wellmark will allow applications to be submitted outside. Obviously, Wellmark is not in the exchange, so they are allowing applications to be submitted up to February 23rd for a March 1st effective date. It is only the marketplace applications, and I guess every other carrier outside of the marketplace, their deadline is still the 15th. So it is only Wellmark individual off marketplace that needs to be, or allows the later deadline of February 23rd.
Okay, and the next question, if I enroll someone through Coventry's website, it counts for the healthcare requirement, correct? I guess I'm trying to understand. If you enroll someone through the Coventry website, I guess are you referring to you're going to enroll them through Coventry and then through the marketplace, or are you just asking the Coventry individual products meet the ACA requirements? I think what we'll do is, Ken, if you have a chance, if you could just give us a call and talk to Tricia. I think that might be the best thing.
So we can make sure we understand the question correctly.
215.
Give Tricia a call at extension 215 just to make sure that we understand your question and we can explain in a little more detail. The next question that we have.
Which one is it? It's the form for the EBS division on the website. The visa stuff that we just received that, I believe it was the day before yesterday, so we'll make sure that everything is out there updated, because obviously we were given wrong information. Wellmark giving out wrong information on that Avisos, and everything, like the benefit summaries, even when your online quoting is incorrect. So we'll get all that up there on our website for you guys to make sure that you have everything, because you should have the standalone Avisos. When you do a standalone group, there should be a pediatric vision benefit out there, as well as they call it the adult buy-up, whether it's an individual basis with Wellmark or small group with Wellmark adding the vision.
And for the two people who have requested, Allison and Sue, I have those PDF forms. So what I will do is I will forward you the emails that we received from Steve Ellingvall, so you have those and you can save them out on your computers and use those for sales. And then we have a question that says, I'm having trouble getting into your website. It says something about cookies and seems very cumbersome. Is it just me, or is this a problem? I think I'll have Nicole talk about that real quick, since she is our technology guru.
Okay, I know we've had a lot of people say about cookies, and I know when it was just me doing my login and doing the updates, because I'm kind of the administrator for the website, it would give me that issue. I would log in the first time, it would say something about enabling cookies. Then I would try and log in a second time, and it would let me in. So I don't know what that was, but I do know that the thing about the cookies is it's kind of system-based, whether or not it gives you that issue. So you're probably not the only one who's affected, but we're trying to figure out how to best solve this problem, because everyone is on a different browser for the internet. Everyone has different updates for their browsers, so it's not easy to pinpoint what's going on.
But we're trying, and we're going to get it fixed.
But normally if you do just log on again, it will let you in. You just have to log on twice, unfortunately. No, and it does not time you out. So if you log in the morning and keep that up, it will keep you in there all day long. It won't time you out.
And then I'd like to make a comment on our phone system. I think you guys probably experienced 3 or 4 weeks back, we tried to change within our phone system, and we took out all of our extensions on the agent team, and we were a live customer service. We would answer the phone, and there wasn't extensions. We wanted to try that to see kind of a customer service call center support type module to see how that would work, and I think we heard you guys and said, we still want to have access to people's extensions, especially if we're working with you on a specific case or an issue. So we have implemented the extensions back in to our system, so you can dial an extension to get to somebody. But you're also still going to get a live person if you don't dial an extension, because, again, we don't want you to get somebody's voicemail all the time. We want you to be able to be answered by a live person. So the extension option is still there, but you're still going to be answered by a live person as well if you don't want an extension or use it.
So we thought that was a very good compromise. Like Nakia said, we implemented back the automated system. However, it's a much more simplified version. Basically, it just is going to say, if you know your extension, dial it now. If you need a directory, press, I can't remember, 1 or 2, or hang on the line and the next available person will help you. So we hope that this is a good compromise and everybody's happy and they can get to the person they want if they know who it is, and if not, they can be answered by a live person.
When a co-op group is sold, do you use the rating area from the home office for new employees going forward, or does the group look up a rate based on where the employee lives? We've had this question a couple of times, and actually with Co-Opportunity and even with Blue Cross, you're going to use the rates based off of where the employer group is based. And unfortunately, their technology is not there yet where I want it to be. And you have to give them a rate sheet. So my advice to you, and then we can work with you on this too, is if you sell a new group, after that, then let's work together and we'll get you a one-page rate sheet that they can use for new employees or for people who need to make changes to their contracts. We have a program called eCopy, so we can specifically type in the name of the group for you, and you have that in the file, and you can use that for the HR person to be able to work with new hires. Again, the technology is not quite there yet, and we're hoping that it will be there soon. Our understanding is with Wellmark, on the queue, eventually the rates are supposed to be there, but I don't know when that's going to happen. We're just verifying to see if anybody has any additional questions. Again, I think you have access to all of our emails and our extensions. And as news alerts happen, as things that we feel are important, we try to push that out to you as soon as possible. We try not to be too cumbersome with the communications that go out, but again, as we feel there's some good alerts, we will send those out to you as soon as possible. And we appreciate your time, and happy Valentine's Day to everybody. And
hopefully everybody has a good weekend, and looks like there's we're getting some more snow out there, so everybody be careful. I think that's the last question. Thank you, everybody. Have a great weekend.